Ontario, and thank you for joining me for further discussion on Module 2, Physical Changes After a Stroke. Today we're going to be discussing changes in balance, positioning, and preventing a fall and preventing injury to your shoulder. Balance is the body's ability to maintain upright posture. It involves the coordination and stability of our bodies in our surroundings and against gravity. Balance is an extremely complex system. It involves information obtained through your vision and your eyes, your inner ear and vestibular system, and the sensors that are found in your muscles and your joints. A stroke can affect your balance by causing a weakness or a loss of sensation in your stroke-affected side. It can cause dizziness or vertigo, perceptual problems or trouble interpreting your surroundings and responding to changes in your surroundings, and vision problems. Difficulty with balance can result if there are problems with sensory messages coming into your brain from your eyes, your inner ear, or your sensory system. They can also result from changes in the ability of your brain to interpret the messages that it's receiving, and also your body's response to the messages, such as adjusting our bodies to stay balanced when we're knocked off balance when we're walking down a hallway. Problems with balance can leave you feeling dizzy or unsteady. This can affect your confidence and put you at a high risk for falling or tripping. There are many steps you and your family can take to prevent falls. Some of these steps are to ask for help. Always wear proper footwear with a closed toe, a closed heel, and a non-slip sole. If you're prescribed glasses, please wear them. Use your mobility aids, such as a walker, a cane, or a wheelchair, and watch for spills and hazards on the floor, such as loose cords, rugs, and pets. I encourage you to speak with your healthcare team about how you and your family can prevent a fall. One of the effects of falling can be injury to yourself. After a stroke, one of the joints of your body at the greatest risk for injury is the shoulder. The shoulder joint relies on muscles, tendons, and ligaments for stability and alignment of the arm bone in the shoulder socket. This allows us to move our arms in many different directions. However, after a stroke, your muscles are no longer able to protect your shoulder, and this puts it at risk for injury. To protect your shoulder from injury, it's very important that you do not pull on your arm or allow others to pull on your arm when assisting you to move or during other activities. Do not let your arm hang from your bed or chair, and make sure that your arm is supported at all times. Learn how to position your arm to protect it and to reduce swelling that can result from leaving it unsupported. It's important that you learn how to assume different positions, whether you're resting in bed or sitting. It's important to change position in order to prevent wounds and keep you comfortable while you're resting. You may need help with turning in bed or getting repositioned for comfort or changing position routinely. It's important to note that you can lie on both sides of your body after a stroke. Some may ask, why would I lie on my affected or weaker side? Lying on your stroke-affected side can help to preserve normal body alignment, provide stimulation to your affected side through sense of touch and pressure. It also gives you another option for resting to prevent skin breakdown, and it promotes circulation and good lung health. In this picture, this young stroke survivor is resting on her stroke-affected side. Note that her affected arm is supported on the bed and she is not lying directly on her shoulder. She is supported by a pillow behind her back, and a pillow is placed between her legs to maintain the alignment of her back. In this picture, the stroke survivor is lying on her unaffected side. Her stroke-affected arm is supported with pillows, and her hand is open. Her stroke-affected leg is supported on a pillow, and once again, a pillow is behind her back to assist her to maintain side lying. In sitting, the stroke survivor has her affected arm on a wheelchair lap tray for support. Her hips and knees are both bent at 90 degrees and her feet are supported on footrests. If you or your family have any questions about strategies to improve your balance, mobility, or increase your comfort when resting, please speak with your healthcare team. Thank you.